Hey folks, Professor Finn, and we are back with our study of pathology. We're going to be looking at Chapter 11 in Pathology Microbiology for Mortuary Science students by Mullins today. Before we get into it, please like, share, subscribe, post this on your social media, let people know that this lecture exists. And let's get the presentation up and let's talk about diseases of the respiratory system. This will be one of the longer lectures that we have in this series. So let's go ahead and get started. So, disorders of the respiratory system. There are two general types, upper respiratory and lower respiratory. In the upper respiratory system, you have the nose, throat, and trachea. In the lower respiratory system, you have the bronchi and lumps. Regardless of classification, they can still be deadly and affect the whole respiratory tract. We will look almost exclusively at pathological respiratory disorders, whereas microbial respiratory disorders will be primarily discussed in the microbiology section of the book, which I've already got that up and running, so feel free to go find the playlist for microbiology, and that will resume the textbook in the appropriate chapters that cover microbiology. So first up, we have rhinitis and sinusitis. Rhinitis is an inflammation of the nasal passages. Chronic rhinitis is commonly an allergy referred to as hay fever. Sinusitis is inflammation of any of the four sinus cavities of the skull. Causes of rhinitis and sinusitis include infection and chemical irritants. Signs and symptoms of these diseases is runny nose, itching eyes, sneezing, and stuffy nose due to congestion. Pharyngitis and laryngitis. Pharyngitis is an inflammation of the pharynx or the throat, and laryngitis is an inflammation of the larynx or the voice box. Both are symptoms of the common cold or strep. Complications of both of these diseases include sore throat and loss of voice. The common cold is a respiratory infection. It is one of the leading causes of healthcare visits and absences from school or work. It is caused by more than 200 different viruses. The most common are rhinoviruses and coronaviruses, viruses that affect your nose and viruses that affect your head. Signs and symptoms of the common cold include sneezing, scratchy throat, runny nose, obstructed nasal breathing, swelling of the sinuses, cough, and headache. Complications of the common cold can lead to secondary bacterial infections of the middle ear or sinuses. Tracheitis. Inflammation of the trachea, bacterial infection of the trachea resulting in the blockage of the windpipe. It frequently follows a viral upper respiratory infection. Common cause of tracheitis is Staphylococcus aureus. Signs and symptoms of tracheitis include a deep barking cough, crowing sounds during inhalations, high fever, difficulty breathing, and intercostal retractions. Complications of tracheitis. This disease almost always requires hospitalization and the use of an endotracheal tube to allow breathing. Young children are easily affected because their trachea blocks easily from the swelling. Bronchitis is an inflammation of the bronchi, the main air passages of the lungs. It comes in both an acute and chronic form. Causes of acute bronchitis is usually a viral respiratory infection that affects the nose, sinus, or throat. Secondary bronchial infections are not uncommon. These infections then spread to the bronchi and lungs, and there are both bacterial and viral causative agents for this type of situation. Chronic bronchitis is inflammation of the bronchi, not an infection. To be classified as chronic, it is a productive cough. It must be present most days of the month for at least 3 months out of the year. So the signs of chronic bronchitis is a productive cough, which means coughing up mucus to clear the respiratory tract and mucus production. Asthma. Sometimes chronic condition in which the bronchi are hypersensitive to stimuli and occurs more often in children than in adults. Causes of asthma include pollen, dust, mold spores, animal dander, respiratory tract infections, food such as eggs, shellfish, and chocolate, and increased fatigue. Signs and symptoms of asthma include wheezing sound, a shortness of breath, and a hunching forward in an attempt to inhale. Complications of asthma can be fatigue, which can then lead to an increase in asthma attacks. As your body gets tired, your body becomes more susceptible. Pneumonia, which is inflammation of the lungs. Clinically, this term can mean an infection of the lungs as well. It is characterized by location, the site of the infection, and the causative agent. So, lobar pneumonia would involve the single lobe of a lung, and bronchial pneumonia, which would be the smaller lung areas in several lobes. What are causes of pneumonia? The majority are bacterial infections, although viruses can cause this as well. Pleurisy is an inflammation of the pleurae, the membrane that surrounds the lungs. Causes of pleurisy are microorganisms. Signs and symptoms of pleurisy are stabbing pain in the affected area, worsening pain during deep breathing, chills, coughing, fever, pale and anxious face, and guarding the affected side or lying on the affected side. Complications of pleurisy can include exudate containing pus, develops between the pleura and empyema, development of fibrous material, and blood in the pleural space, which can result in hemorrhagic pleurisy. Tuberculosis is a highly contagious disease spread through the air. The World Health Organization has declared tuberculosis a global emergency due to the global breakdown in health services, spread of HIV/AIDS, and the emergence of multi-drug-resistant tuberculosis. The Mycobacterium tuberculosis is a waxy coat that allows it to stand extreme changes in the environment. Causes, as I just said, is Mycobacterium tuberculosis. Signs and symptoms are sneezing and coughing. And the pathogenesis of tuberculosis. It forms lesions known as tubercles that occur when the immune system walls off infected areas, which eventually rupture and the disease spreads. The surrounding tissue becomes necrotic and develops caseation, or cheese-like substance. Usually, hemoptysis occurs, which is bloody sputum. So you're coughing up blood. And it causes cavitation in the lungs, cavities in lung tissue or other organs. Complications: tuberculosis can become multi-drug resistant, and this is typically a result of inconsistent or partial treatment. Providers prescribe wrong treatment or prescribe unreliable drugs. When you are given a diagnosis of tuberculosis and you are told to utilize your medications in a certain way, you must continue with the medications until they are concluded, not when you start feeling better. By stopping the drug when you are feeling better does not mean that the virus or the microorganism has been sufficiently killed, and it will just come back stronger. Emaciation and dehydration in chronic cases is a common thing. Treatment for tuberculosis is pharmaceuticals. Pneumoconiosis, inflammation of the respiratory system caused by inhalation of mineral dusts. Dust in the lungs causes macrophages to accumulate in the lungs, and they release chemicals harmful to the tissues in the lungs. This combination of dust and chemicals results in fibrous masses that grow within the lungs. There are specific types of pneumoconiosis. So the first one is co-workers pneumoconiosis, also known as black lung disease or anthracosis, which is caused by coal dust. You also have silicosis, which is caused by the inhalation of crystalline silica. And once again, this is an occupational exposure as a result of mining and quarrying. You have asbestosis, which is the inhalation of asbestos, and berylliosis, which is a result of the inhalation of beryllium. The signs and symptoms of pneumoconiosis is fibrous masses in the lungs. Complications associated with pneumoconiosis is heart failure, cancer, and other respiratory disorders up to and including death. Atelectasis, or collapsed lung, is a loss of lung volume due to inadequate expansion of the air spaces. So causes for this can be obstructed, choking on foreign matter, tumors, fungal infections, excessive mucus, and an entire lung or a part of the lung may collapse. But there's also non-obstructive, loss of contact between the parietal and visceral pleurae, compression, loss of surfactant, or scar tissue. Complications? Well, you can have something called pneumothorax, where the lung is completely collapsed due to a puncture which causes air to leak into the pleura, which prohibits the lung from expanding. And hemothorax, which is blood leaks into the cavity instead of air, which causes the collapse by leaking into the pleura. So as the space fills with blood, the lung cannot expand. Emphysema, which is a chronic inflammatory disease of the respiratory system. So the causes of emphysema, it's typically a secondary disease due to infections, long-term smoking, and pneumoconiosis. Signs and symptoms of emphysema include barrel chest and pursing of lips when exhaling. Lung abscesses. Inflamed, pus-filled tissues in the lung caused by infection when bacteria is inhaled from the nose and mouth. Many people develop only one abscess, but more than one can occur. Causes for lung abscesses include periodontal gum diseases, so brush your teeth, floss, and use a quality mouthwash, tumor in the lung, and pneumonia. Signs and symptoms of lung abscesses: large amounts of pus, fluid, and blood are expectorated. In other words, you are spitting up, coughing up large amounts of pus, fluid, and blood. Sounds delightful. Complications of lung abscesses include empyema, which is caused when the abscess eventually ruptures into the pleural space. Fungal diseases. There are a variety of fungal diseases that affect the respiratory system. Many fungal diseases of the respiratory system are complications of AIDS. Some of the most common fungal diseases of the respiratory system include histoplasmosis, aspergillosis, coccidiomycosis. Each of these fungal diseases is described in detail in Chapter 28 of Microbiology. Once again, you can jump right over to the Microbiology playlist, hit play, and learn all about these things. Cystic fibrosis, the most common fatal genetic disease in the United States. It is a terminal disease in most cases, and you pass away around the age of 20. What causes this? It is a mutation in the cystic fibrosis transmembrane regulator gene. Signs and symptoms: you will have salt imbalances in the cells. Complications of cystic fibrosis include a production of thick, sticky mucus that clogs the lungs, leading to infection and blocks the pancreas. The thick mucus stops digestive enzymes from reaching the intestines to allow proper digestion. Respiratory polyps. It is a tumor with a pedicle, which is a stem that attaches to the surrounding tissues and supplies it with blood. Causes of respiratory polyps include chronic allergic rhinitis or sinusitis. Signs and symptoms: well, you will have blood that will become apparent because you will bleed easily as you are coughing things up or dripping, and this may become cancer. Large polyps may also interfere with breathing. The treatment for respiratory polyps is really just surgical removal. Carbon monoxide poisoning. Carbon monoxide is a colorless, tasteless, odorless gas produced by burning material containing carbon, referred to as the silent killer. Hemoglobin is 200 times stronger to bond with carbon monoxide than it will with oxygen. Once it bonds with hemoglobin, the reintroduction of oxygen is not sufficient to restore proper oxygen in the blood. This kills you by impairing your central nervous system, which causes the individual to not realize they are poisoned and seeking help from its effects. Causes of carbon monoxide poisoning include gas water heaters, kerosene space heaters, charcoal grills, propane stoves and heaters, propane-fueled forklifts being used in confined spaces, gas-powered concrete saws, indoor tractor pulls, swimming behind a motorboat, inhaling spray paint solvents or degreasers, riding in the back of a pickup truck near the exhaust, working indoors with combustion engines, steel foundries, home fires, fireplaces, and wood stoves. You really want to make sure that you have proper ventilation. Signs and symptoms of carbon monoxide poisoning are headache, dizziness, hallucination, cherry red discoloration of the skin and mucous membranes, drowsiness, shortness of breath, chest pain, impaired vision, confusion, agitation, vomiting, abdominal pain, and seizure. Complications of carbon monoxide poisoning include swelling and hemorrhaging of the brain. Flail chest, the paradoxical movement of a segment of chest wall caused by 3 or more broken ribs in 2 or more places. As the lung increases during inhalation, the broken ribs do not move to accommodate it. As lung decreases during exhalation, the broken ribs move in. Causes of flail chest are trauma, crushing injuries breaking the ribs in one or more places. Complications include severe respiratory distress and death. Lung cancer. Lung cancer is the leading cause of death among men and women in the United States. There are 2 types of lung cancer: small cell lung cancer, which is small cell carcinoma or oat cell carcinoma. This is associated with smoking and grows rapidly and spreads to other organs. You have non-small cell lung cancer, which are the majority of lung cancers. And within this, you have squamous cell carcinoma, which begins in the bronchi and is associated with smoking. You have adenocarcinoma, which develops along the outer edges of the lungs and under the membranes lining the bronchi. And large cell carcinoma, which appears in the lung and can spread to anywhere else in the body. Giant or clear cells distinguish this cancer, hence its name, large cell carcinoma. Causes of lung cancer include exposure to compounds during mining and manufacturing, inhalation of fibrous materials, chemicals, and smoking. Signs and symptoms of lung cancer include chest pain, shortness of breath, hoarseness, coughing up blood or hemoptysis, pneumonia, bronchitis, wheezing, swelling of the neck and face, chest, shoulder, or arm pain, headache, and unexplained fever. Complications of lung cancer. Typically, it is rarely found early on and usually means it is spread beyond the primary tumor by the time it is discovered. Chronic obstructive pulmonary disease, or COPD. It is a respiratory disorder in which the bronchioles become occluded and the alveolar sacs become dehydrated. Complications of COPD include the bronchioles becoming plugged and developing bacterial infections that make breathing difficult and unable to exhale normally due to the presence of air caused by emphysema. Hanging and strangulation. These are deaths by asphyxiation, and asphyxia is the inability to take in necessary amounts of oxygen. So, causes, well, hanging, strangulation, compression of the jugular veins without concurrent compression of the carotid arteries. If both carotid arteries are compressed, the loss of consciousness will occur in around 10 seconds. If only the jugulars are compressed, it takes about 1 minute. And the final cause is airway obstruction, choking. Signs and symptoms of hanging and strangulation include congestion of the veins of the face, facial edema, cyanosis, which is the presence of deoxyhemoglobin or deoxygenated blood, petechial hemorrhages of the face and eyes, and ligature marks on the neck. Drowning. Death secondary to asphyxia while immersed in a liquid or within 24 hours of submersion. So even if you have an incident in the water, you are brought out of the water, you are hospitalized, and you still die as a result of that incident, it is still going to be considered a drowning. Of all injury deaths of children, drowning is the second leading cause. 80% of all drowning victims were male, and African American children are 2.5 times more likely to drown than Caucasian children. In 1992, half of all drownings were alcohol-related. Pathogenesis. There is a brief period of initial gasping. Being underwater also stimulates hyperventilation. The breath is held until spasms of the larynx occur, at which point hypoxemia occurs. Anaerobic respiration causes lactic acid to build in the cells, causing lactic acidosis, i.e. cramping. And then you have cardiac arrest or brain death. The airway potentially relaxes, but usually remains closed, and the lungs do not fill with water until well after the death has occurred. So what are some post-mortem conditions associated with diseases of the respiratory tract? You have cyanosis, and if you have cyanosis, if you are lucky, you are catching it early on so that you can flush the deoxygenated blood. If you are unlucky, you are going to have some pretty bad formaldehyde gray. There is emaciation, in which case a major concern here is going to be dehydration of tissues. So you're going to want to using moderate index chemicals, as well as the inclusion of proper co-injection chemicals. Hydrothorax, this is going to create pressure on your injection, so you may need to go in with your trocar and get some of that air out in order to relieve that pressure. Hemorrhage, which can cause swelling as well as distribution issues. And cavitation, which realistically there is not really much you can do about that. However, when you are doing aspiration of the thorax, you are going to want to be very thorough with the aspiration and very liberal with the application of cavity fluid, probably even going as far as doing a second application of cavity fluid to make sure that anything that was causing the cavitation, such as microorganisms, is being killed, is being drained, and then more preservative cavity fluid being added to the body. That concludes this lecture. Once again, folks, make sure to like, share, subscribe, drop something in the comments below, shoot me an email, let me know how I'm doing, and we will see you next video.